Okay, let's unpack this. We are diving deep today into what really matters when you're interviewing for a critical care clinical nurse specialist role.
Hmm.
So like this excerpt, right, from a Kaplan article,
Hmm.
it lays out some key interview questions, suggested answers. Kind of gives us a direct window into the expectations.
Absolutely. And I think it's useful to think of these questions not just as, hurdles to clear in an interview, but more like a map.
A map, okay.
Yeah, looking at what they ask and what kinds of answers seem to be valued, it reveals a lot about the core skills, the knowledge base, even the mindset really required for someone stepping into this specific, very crucial specialization.
Exactly. So our mission right now is to take this source material, just these questions and insights, and pull out the most important nuggets for you.
Right.
We want to help you get a fast, but, pretty thorough understanding of what makes a successful critical care CNS candidate based purely on these points here.
It's like trying to understand the DNA of the role, but through the lens of how they interview for it. What do they really want to know? What signals are they actually looking for?
Okay, so let's jump right in. What kind of things does this source material suggest are important? First question it highlights kind of gets right to the heart of it. What inspired you to become a critical care clinical nurse specialist?
And the suggested answer, it really emphasizes a deep, almost intrinsic connection to critical care. It talks about feeling like this is where I truly belong.
Hmm.
That sense of passion for the field and this drive to pursue more education, specifically to make a positive impact.
That's interesting. So it's not just about skill or knowing your stuff. It's this underlying passion. Why do you
Yeah.
think showing that genuine connection is so critical for this role?
Well, because critical care is just inherently high stress, right? High stakes, emotionally demanding.
Yeah.
Just being competent. Well, it isn't really enough to sustain someone in that environment long term, especially not in a leadership and expert role like a CNS. So I think interviewers are looking for that inner drive, that feeling that you're kind of meant to be there, because that speaks to resilience. It speaks to long term commitment, things you absolutely need to thrive as a critical care CNS.
That makes a lot of sense. Okay, so once you've established that passion,
Hmm.
the next logical step seems to be experience.
Hmm.
The source brings up, what experience do you have working with critically ill patients? This feels like where the rubber meets the road, clinically speaking.
Oh, it absolutely is. The source suggests needing several years of experience, and it specifically calls out ICU and CCU settings.
Right.
And it lists familiarity with conditions like, well, the big ones: sepsis, respiratory failure, shock, those really complex multi-system issues.
And they even mention experience with major post-surgical patients like heart and lung transplants. Wow, that covers a huge range of complexity and acuity.
Precisely. But, it's not just about seeing those conditions. The suggested answer also highlights the skills you develop through that experience,
Okay, like what?
like managing complex patient needs, administering critical medications, providing advanced treatments, and crucially, working effectively within those multidisciplinary teams.
Ah, the team aspect. Yeah.
This question really probes whether you've been in the trenches,
Yeah.
with the sickest patients and learned how to navigate both their clinical needs and that complex team environment that always surrounds their care.
Right. And navigating that environment definitely requires staying sharp. So how does a critical care CNS keep their knowledge cutting edge? The next question highlighted is, how do you stay current with the latest developments in critical care nursing?
Yeah, and the source provides a really quite comprehensive picture here. It starts with foundational things like
Hmm.
reading professional journals, attending continuing education, the basics,
Sure.
but it goes much deeper than that.
They specifically call out getting involved in professional organizations,
Yeah.
right? Like the American Association of Critical Care Nurses and the National Association of Clinical Nurse Specialists.
Right, exactly. And being part of local and national interest groups, attending conferences, workshops, this whole list tells us that staying current isn't passive.
No.
It's an active engagement with the whole critical care community. For a CNS, this isn't just about, personal development. It's about being the unit's expert. It's about bringing the latest evidence-based practice right to the bedside and leading change. So these activities, they signal a proactive commitment to leading with the best available knowledge.
Okay, so moving from knowledge and experience to approach the fourth question is about philosophy of care.
Hmm.
What is your approach to patient care?
Here, the source really emphasizes patient-centered care. That's the fundamental principle. But it expands on that quite a bit.
How so? It highlights building strong therapeutic relationships,
Mhm.
not just with the patient, but also with their families,
Right?
and involving them in the care plan.
That family piece is huge in critical care, isn't it?
Yeah, definitely.
I mean, often the patient can't speak for themselves, and the families are going through immense stress, sometimes grief already.
Mm.
The source also stresses a holistic approach, considering physical, emotional, and spiritual needs, and collaborating seamlessly with the rest of the healthcare team. This question really gets at the heart of the CNS role as an advocate and a resource. It requires pretty sophisticated communication and a broad perspective that goes way beyond just the medical problem itself.
When you combine those complex patients and families with these high-stakes decisions, you're absolutely going to face intense situations. So how does a critical care CNS approach problem solving? That's question 5. What is your approach to problem solving in critical care situations?
Well, the approach outlined is very structured, very deliberate. It starts with that crucial first step. Remain calm. Think critically first.
Right. Easier said than done sometimes, I bet.
Oh, absolutely. But in critical care, panic just isn't an option.
Okay, so after, stay calm.
Then it's about assessment. Gather information from everyone involved, the patient if you can, the family, the entire healthcare team.
So pulling it all together.
Exactly. It's about synthesizing information from multiple sources, often under intense pressure. Then you prioritize the most urgent issues, develop a concrete plan of action, and critically, you continuously reassess the situation. You have to be ready to adjust that plan as needed. This structured yet flexible approach is just essential because critical care environments, they change so rapidly and decisions have immediate significant consequences. It shows you can manage chaos with clarity.
Clarity under pressure. That
Yeah.
definitely requires managing yourself, too. Which brings us neatly to the final question the source highlights. How do you handle stress and pressure in a critical care setting? I mean, this role is inherently demanding.
It is, probably more so than many other roles, honestly, given the constant exposure to life and death situations and the responsibility of supporting patients, families, and the nursing staff.
Right.
So the suggested answers, they cover both professional tactics and personal resilience strategies.
Like staying organized and prioritizing tasks,
Hmm.
which is, standard good practice anywhere.
True, but they also specifically mention self-care. Things like healthy eating, exercise, getting enough sleep. Having a robust support system is key too. Colleagues you can debrief with, family, and practicing mindfulness techniques like deep breathing or meditation. Now, this isn't just fluff, right? These are recognized strategies for building resilience.
It really sounds like they're looking for someone who not only has the clinical chops, the skills, but also the self-awareness and the tools to actually sustain themselves when facing relentless stress.
Absolutely. For a CNS who might also be involved in really difficult ethical discussions or supporting staff through trauma, maybe driving systemic change, personal well-being isn't a luxury. It's actually foundational to being effective and preventing burnout. This question really probes your capacity for sustained high-level performance under pressure.
It's fascinating how these questions, just drawn directly from this one source, they paint such a complete picture of the ideal candidate. It touches on everything from deeply personal motivation to complex clinical skills and that personal resilience.
They really do map it out quite well. And, it's worth a quick note. The source also mentions that CNS roles exist in various specializations like adult health, cardiology, emergency, neuroscience, trauma ICU, things like that.
Oh, okay.
Which just underscores that while there are core CNS competencies, the critical care role we've been discussing is a highly specialized application of those.
Right. So to kind of wrap this deep dive into your source material, these key interview questions reveal that what's truly valued at a critical care CNS, it goes way beyond just a resume of skills. It seems to be about demonstrating that genuine, deep-seated passion for critical care, then backing it up with substantial, relevant experience managing really complex patients and teams.
Yep.
It requires a palpable commitment to continuous learning and bringing that knowledge to bear. Approaching care with a profoundly patient and family-centered, holistic perspective.
Right.
Employing a structured, calm method for those high-stakes problem-solving moments. And critically, possessing robust personal strategies for managing the inherent stress and pressure of the whole environment.
Together, yeah, these points from the source offer a concise, yet I think pretty powerful snapshot of the multifaceted expectations for this advanced practice role.
Okay, now here's a provocative thought for you, drawn purely from the insights we've just pulled from this source. Consider how the combination of skills highlighted for this role, everything from managing complex medical conditions with that structured approach, to building therapeutic relationships with families, and practicing mindfulness and building a support system for stress, Consider how this paints a picture of a role demanding an exceptional blend of advanced clinical expertise and profound personal capacity. What does this pairing suggest about the evolving and maybe increasingly demanding nature of highly specialized nursing roles like the critical care CNS in modern healthcare?
It certainly gives you something to think about, doesn't it, regarding the future landscape of advanced practice nursing.
It does. And that was our deep dive into your source material, helping you quickly grasp the key insights into interviewing for the critical care CNS role.